We cannot repair the economy, restore our vitality, or relish life's most precious moments until we get it under control. I will spare no effort, none, or any commitment to turn around this pandemic.
In just hours, President-elect Joe Biden will announce his COVID-19 task force.
So what will a Biden administration do differently? Fox News medical contributor Dr. Janette Nesheiwat joins me now. Dr. Janette, great to see you as Joe always. What we do know is it does appear Dr. Vivek Murthy, former Surgeon General, is going to be co-chair of this task force. There's a picture of him right there. What do we know about Dr. Murthy?
Sure, Todd. Good morning. So Dr. Murthy, he's actually served our country in the past. He's an internal medicine doctor. He's worn the uniform. He's actually served as Surgeon General. So he has the experience. He's a great doctor. But again, he's an internal medicine specialist. He is not an infectious disease specialist. So that is critical because coronavirus is an infectious disease similar to Ebola, HIV, influenza, that sort of thing. So very important that they do have an infectious disease expert leading the team because this virus has taken the lives of thousands of people in this country. So we need to make sure that obviously the health and safety of Americans being led by an experienced doctor is on that task force. Very important.
Who would you suggest if you had the opportunity to give a recommendation of an infectious disease expert? Or do you think that they might have a short list already?
Sure. So, well, currently we have Dr. Birx, we have Dr. Fauci, we have Admiral Giroir, and they're doing a tremendous job on trying to mitigate the amount of deaths in this country. So we don't want to undermine or disrupt all the amazing work that they are doing. They are the world's top experts, and we're just, for example, a month away from a vaccine. So they're working very hard, and their actions and their advisory to the current administration is really doing a lot to save lives. So it's again, they are the nation's top experts, and we can't overlook that or undermine their hard work.
Meantime, doctor, let's take a look at the Biden-Harris COVID-19 plan, restore the National Security Council, Director for Health Security and Biodefense, a few more things, but the thing that stands out is definitely that national mask mandate. Is that a good idea?
So I think it's very important if you are unable to social distance, if you're in crowded areas, then you want to protect yourself. You want to wear a mask. But I don't know if that's going to make a life-changing difference. Just like it's mandatory to wear your seatbelt. It's mandatory to wear a helmet if you're on a motorcycle. Some people are not going to abide by the rules, and we're still going to see, sadly, unwanted outcomes such as death. But it may help slightly. But I think using common sense, practicing social distancing, avoiding large crowds altogether with a mask will make a difference. Absolutely.
Okay, and speaking of large crowds, look, for the last few weeks and months, there has been a lot of criticism directed at President Trump for his rallies with the crowds, with people not wearing masks. And then we saw a lot of crowds out on the streets on Saturday. You're taking a live look now, and while you were looking at Philadelphia, not a live look, excuse me, from Saturday, Washington, D.C., you can see the crowds out here as they're celebrating, the news that came down of President-elect Joe Biden. And now some people are questioning, the same thing on the other side. Like, how are crowds allowed to be able to go out there and celebrate like this? Should they be able to? What do you think when you see these images? Because, look, if you're going to criticize one side, you have to criticize the other as well.
So let's follow the CDC guidelines. We know firsthand, and we've learned so much this past 6 months, large crowds, lack of social distancing. This is grounds for transmission. These are breeding grounds for transmission of the virus. Could potentially be a super spreader event. So we have to take precautions. We have over 50,000 Americans who are hospitalized right now, and over 10,000 of them are in the ICU. And we're seeing an acceleration of hospitalizations right now, and that is showing us that it's, really a true disease burden in the community. So it's very important that we abide by the rules, abide by the CDC guidelines to keep that curve flattened so that we don't overwhelm hospitals, because these type of events, whether it's a protest, whether it's a rally, whether it's, a party, you can have what's called the super spreader event. One person can spread to another and can ultimately spread to 10 other people, and then we see this exponential rise. So very important that we practice that social distancing, wear your mask, and avoid large crowds.
COVID doesn't discriminate based upon party.
That's right.
Dr. Janette Nesheiwat, we appreciate your time. Thanks so much.
Thank you.
Thank you.